Welcome to TLDR Neuropsychology, where we cover various topics related to the clinical practice of neuropsychology. We're starting a series related to board certification in clinical neuropsychology. So to start off with, we're going to just kind of give a brief overview of the board certification process and some of the boards that exist for clinical neuropsychology. So we're going to talk about some of the necessary training experiences to be board eligible. We'll discuss a little bit about the different neuropsychological boards. We'll talk about some of the process, particularly about the written exam, having your work samples reviewed, as well as the oral exam. So just to start off with, board certification is not required to engage in neuropsychological practice. That said, many hospital systems, as well as other professional organizations, are hiring based on either current board certification or board eligibility. There's been a big push to evidence your capability in clinical neuropsychological practice through board certification. So qualifications for board eligibility are based off of Houston Conference guidelines. I'm not going to list through all of the guidelines, but in general, you need to have a doctoral degree in clinical neuropsychology from an APA or CPA accredited institution. Additionally, you need to have gone through an accredited internship. The guidelines require a 2-year postdoctoral fellowship specializing in clinical neuropsychology with the goal to develop and demonstrate all the relevant knowledges and skills related to competent practice in clinical neuropsychology. And you need to be appropriately licensed for independent practice. All that said, the different boards have indicated that there is some flexibility in the exact training path. So even if you don't meet those criteria specifically, if you have appropriate experience, they can work with you. There's 2 primary boards. There's the American Board of Clinical Neuropsychology, or ABCN, and I've included a link to their webpage for additional information, as well as the American Board of Professional Neuropsychology, or ABN. And the process between each board is generally fairly similar, but there are some subtle differences. With ABCN, you can also subspecialize in pediatric clinical neuropsychology. Both boards allow a 7-year candidacy period after your application is accepted. Generally, it starts with the application and a credential review to make sure that you're board eligible. If you're not board eligible, likely you won't get past that step on to the next ones. Furthermore, you'll undergo a written exam to demonstrate your knowledge of clinical neuropsychological principles and information. You'll provide work samples for the boards to review, as well as you'll undergo an oral exam. And there's some differences between the boards for some of these processes. So for AACN, their written exam is 100 multiple choice questions about different neuropsychological topics. They also have 25 pre-test items that won't count to your score, but could end up on later tests. Their time limit for the test is 2.5 hours, and the results are pass-fail. So 300 and above is a pass, 299 or below is a fail. They don't give a specific criteria for how they convert your score into those different ranges, but it's probably some standardized, normalized process. You can fail the written exam 3 times before you're required to start a new application. The ABN written exam is a little bit different. It's 150 multiple choice questions. Once again, just of general knowledge expected for someone practicing in clinical neuropsychology. You'll have 3 hours to complete the exam, and if you fail the exam, there's time delays following each failure before you're allowed to take the exam again. So if you fail the exam the first time, you have to wait 6 months before you can take it again. If you fail the exam a second time, then you have to wait a year before you can take the exam again. Once again, after 3 failures, you have to restart the exam. But for ABN, you have to wait 3 more years after failing the 3 exams before you can reapply. The AACN work sample review, so you'll send in de-identified work samples for 2 typical cases that you see in your independent practice. So a work sample includes the report, raw data, and data summary. You could also provide additional supplemental information. Both cases must notably differ to demonstrate your range in clinical knowledge or assessment skill. And generally that means that the cases either have a different purpose for the evaluation or significantly different clinical presentations. So these work samples are reviewed by 3 professionals, and 2 of the 3 must determine that the case is acceptable before you can move on. Rejected work samples require resubmission of alternative cases. And you can continue to resubmit work samples until they're both accepted, until you either pass or your candidacy period ends, which would be 7 years from the initial application approval. For ABN, the work sample review is, once again, 2 de-identified work samples, but these cases have to be seen within the past 2 years. Also, they have very strict submission instructions that need to be followed, otherwise your work samples will be automatically rejected. So you're strongly encouraged to contact the work samples coordinator for assistance to make sure that everything is sent in appropriately in the appropriate format. They recommend having clear-cut cases with appropriate supporting documentation. So that includes things like additional medical records, collateral interview information, those kinds of things. It can be really helpful to have appropriate neuroimaging as well. They also require a 5 double-spaced page introductory rationale where you outline your approach to the case conceptualization, your rationale for the test that you selected, how you developed your opinion about the case, factors that influenced the differential diagnoses that you went through, support for your diagnostic hypothesis, and the rationale for the recommendations that you offered. They have criteria for automatic failure at ABN, and that includes if you improperly de-identify the documents you send in, if you make 2 or more scoring or score transposition errors. So for example, even if you score it correctly, if you use the wrong label range in the report, that would count as a score transposition error. You can also automatically fail if you use incorrect test or normative data. So for example, you use race-based normative data for a race that the person doesn't fit in. You can also automatically fail if you lack performance validity measures in the test that you administer, or if you use automated computer-generated test interpretations. So these work samples are reviewed by 2 other neuropsychological professionals, and they have a standardized scoring criteria when they go through the work samples that must be over 70% for the sample to be accepted and you to move on. If there's a difference between the scores, so one rates you as a 69% and the other rates you as a 70%, then a third reviewer will go over the work samples, and his consensus with one of the other reviewers will ultimately decide whether that work sample is rejected or accepted. As far as the AACN oral exam goes, there's 3 consecutive sessions that are 45 to 55 minutes long with 3 AACN examiners. And there can be other people present, and there may be students present that are just going to sit there and watch the process. So the first session is a review and defense of your work samples. So they'll kind of pick apart everything about the work samples that were provided, and you have the opportunity to explain your rationale and the process that you went through. The second session is a fact-finding session. So they'll give you kind of a brief description of an unfamiliar case. You can choose whether it's an adult case or a pediatric case, and then you have to ask questions to figure out any of the information about the case that you'll need to form an appropriate diagnostic impression. So they'll only provide information that you specifically ask about the case. So if you don't ask, you won't get the information. And you have some time before to kind of write down your write down kind of a organization for your interview so that you can make sure that you don't miss any important questions. And then the third session is about ethics and professional practice. So you'll get a brief vignette, and you'll have to identify and explain the ethical issues that are relevant in that vignette. Another part of it will include describing your own clinical practices, your continuing education activities, as well as any ethical or legal issues that you've encountered in your practice. It can be helpful to really discuss in detail about what appropriate ethical practices are and how you might mitigate some of the ethical controversies that typically come up in clinical practice. So 2 of the 3 examiners must consider it a pass for you to become board certified. If you fail, you have 1 additional attempt before you have to submit a new practice sample. If you fail the oral exam a 3rd time, then you have to restart the application process from the beginning. For ABN, this one is 2 one-hour sessions administered by ABN examiners. So the first session is about your work style. So it's questions related to your clinical philosophy and general approach. You'll also select 1 of 2 clinical vignettes and discuss in detail how you would conceptualize and evaluate that case. The second session is about ethics and professional standards. So you'll select 1 of 2 clinical vignettes and discuss the ethical issues present. Once again, it can be helpful to discuss how those ethical issues could have been resolved. So they have an objective scoring criteria. Once again, they don't list what that criteria is, uh, but each of the examiners will score you as you're going through the oral exam on that criteria. And then you'll be notified of the results of the oral exam after 2 weeks. You can retake the oral exam 2 additional times if you fail, before you have to reapply from the beginning. But once again, if you fail the oral exam 3 times, there's a 3-year waiting period before you can reapply from the beginning. So here's some more useful information and study resources. These first 2 are links to the different boards, so you can get information directly about them from the beginning. This BRAIN, AACN, is a organization to help people prepare for board examinations. So it's a very helpful website. You can get mentorship and other kinds of assistance through that website. So this has been a brief overview of board certification in neuropsychology at TLDR Neuropsychology. Be sure to like and subscribe. Thanks for coming out. Bye.